Everyone in this chamber knows how bad the opioid epidemic is. In my state, we have the second highest number of opioid deaths per capita in the country, next to West Virginia. We also, in my state, have more people die of opioid overdose than any state in the country. If averages hold, 11 people died yesterday, 11 will die today, 11 will die tomorrow. 11 will die on Thursday in Ohio from opioid overdoses. Last month at the Cleveland City Club, I called for a comprehensive, coordinated, sustained public health campaign to fight addiction through education and prevention, through treatment, through recovery. We know from history that we cannot arrest or execute our way out of this crisis, whether in Montana or in Ohio. I've met with law enforcement officers in every corner of my state. They shoulder a huge burden. They all tell me the same thing. They need resources to fight this. That's why I've joined Senator Portman and a bipartisan group of our colleagues in the POWER Act to get state and local law enforcement the high-tech tools that they need to effectively screen for dangerous opioids like fentanyl. We also know from history that those enforcement tools are just one piece of this fight. We need a comprehensive approach. That means recognizing how important treatment and rehabilitation are. You don't write off thousands of Ohioans struggling with addiction. You simply don't write off entire communities. That's where drug courts come in. These courts are partnerships between local law enforcement and treatment providers. They're spearheaded by judges who see the same people back in their courtrooms over and over again for drug offenses. These judges realize that traditional court proceedings simply were not working. They weren't curing people's addictions. Fines and jail time don't cure a medical condition. But so judges set up these special courts where participants agree to enter treatment programs and are strictly supervised by law enforcement. If they successfully complete the program, instead of heading to prison, they hold a graduation ceremony. We've seen this model work successfully for veterans. Hundreds of these courts across the country built around counseling and treatment. Veterans who get into trouble with law often face unique issues like PTSD. My office recently visited the First Federal Veterans Court in the Southern District of Ohio in Dayton. We saw the difference it makes in the lives of men and women who served our country. The court was created by my friend Judge Michael Newman with the support of Chief Judge Ed Sargas. It works with the VA to help address the issues veterans are struggling with. My staff met with Paige Lehman, a Veterans Justice Outreach Coordinator who helps participants in the program. He talked about how one of the participants in the court had limited transportation options and lived in a rural area, so Mr. Lehman drove to meet him at the local library. Judge Newman reports that 49 veterans have graduated from the program with their charges dropped and are now leading healthier lives. We have the same opportunity with drug courts. The Ohio Office of Criminal Justice Services evaluates and studies these courts. They found drug courts enhance treatment, increase collaboration in their community, and save taxpayers money. We met with judges across Ohio who are helping people break the cycle of drug use and crime. Earlier this year, I talked with Hocking County Municipal Court Judge Fred Moses while he was in town as a State of the Union guest of Representative Steve Stivers of Ohio. He started an innovative drug court program just outside Chillicothe, south of Columbus, in 2012. He saw the opioid epidemic coming years before most folks in Washington saw it. He started the first medication-assisted drug court program certified in my state. 5 years later, his programs are reuniting families, cutting down on repeat offenses, helping participants get jobs. He and his staff are improving the lives of people in Southeast Ohio and serving as a model for other drug courts around the state and country. Since the program began, more than 30 other judges have visited Hocking County to learn about its success. Now we're seeing similar success all over Ohio. Tuscarawas County has 2 drug courts, Cobra and the Common Pleas Court and the New Philadelphia Municipal Recovery Court. Judge Elizabeth Lehigh Tomakis runs the Cobra Court, which held its 125th graduation ceremony last week. One graduate said, "When I couldn't get clean, you helped me get clean. When I couldn't set boundaries, you set them for me. You guys believed in me when I couldn't believe in myself." Another, "My daughter has her mama back, a healthy mom, hardworking, motivated, goal-oriented mom who smiles again and is grateful in all she does. By this program shaping my future, it also shaped hers. The Recovery Court in New Philadelphia is run by Judge Nanette DeGarmo Van Allman. She hears so many stories like that. When she told the Times Reporter, the newspaper in Tuscarawas County, we try to give them and their families hope that treatment works and people do recover. Programs all over Ohio, all over the country are offering families that hope. In Cleveland, the Cuyahoga County Drug Court under Judge David Mattia has graduated 300 people. That court in the Cleveland Municipal Drug Court operated under the Stephanie Tubbs Jones Greater Drug Court umbrella named for my former colleague. In Marion, Ohio, Common Pleas Judge Jim Slagle, a longtime friend of mine, held a ceremony for 8 graduates at the end of last month. One of the women who spoke, Jennifer, talked about her granddaughter. The most challenging part was admitting I needed this. When she found out her granddaughter was going to be placed in foster care, quote, I knew I had to do something. I needed to get myself together. I had to do it for her. She's now been clean for 2 years. She has custody over her 18-month old granddaughter. These are the kind of success stories we hear all over the state, all over the country. If we're successful in this fight, hundreds of thousands fewer Americans will use opioid. We'll also have hundreds of thousands more who have used opioids, but whose lives are not lost or ruined. They're going to be living with and managing their addiction. That's why we need to expand and build on these approaches. I'm also working with my Republican colleague, Senator Capito of West Virginia, on bipartisan legislation, the CARE Act, to combine existing resources from the Departments of Labor and Health and Human Services to fund combined addiction treatment and workforce training efforts. I hear the same thing from mayors from New Philadelphia and Middletown and Chillicothe and Piqua. Employers can't fill openings because workers can't pass drug tests. And Ohioans struggling with addiction, even those who have completed successful programs, can't find a job. Our bill will help those Americans continue their recovery with good jobs that provide stability. So the government's spending money on drug treatment, mostly through Medicaid, government through the Department of Labor is spending money on job retraining. Why not put them together so that people can, while they get clean, while they get whole, they are ready to go to work because they will have that job training. I hope my colleagues will join me in supporting the CARE Act and in finding ways to support successful drug court programs around the country. Mr. President, I ask that the remainder of my remarks be placed a different place in the congressional record.